Hi everyone. My name is Roxanne Roberts. I am a student at the College of Mount St. Vincent, and today I'll be doing a tutorial on a stroke patient. So the big question is, what is a stroke? What is it? So this is where the blood rich in oxygen cannot be reached to the brain nor to the cells. So stroke is when the blood cannot go to the brain nor to the cell. And you have three different types of stroke. It's ischemia, TIA, which is a transit ischemia. It's similar to ischemia, but it's like a warning, like, hey, something is not right. Get it fixed right now. Basically a warning. And you have hemorrhagic. So ischemia stroke is basically a blood clot within the vessel, or stenosis, which is the narrowing of the vessel. It is not able to feed the brain tissues, and it limits the blood that gets to the brain. Now when the blood is limited to the brain, you have to act fast, because the quicker you act, the better it is. The better you are at saving those brain cells. If you act slow, the more brain cell you lose and the less chance you have in saving the brain cells. So the reasons for ischemic stroke, you have embolism. Embolism is a clot that has left a part of the body and traveled to the brain, which stop the flow. So an example of this is the heart valve problem. You can have atrial fibrillation and it traveled to the brain. Thrombosis, a clot formed within the artery wall within the neck or the brain, and it's seen in patients with a hyperlipidemia or arteriosclerosis. Hemorrhagic stroke. This is where bleeding occurs in the brain due to a break in the blood vessel. This leads to no blood to perfuse the brain cell, excessive swelling, and leakage from the brain. So just imagine that you have a pipe, right? And the pipe is broken. What's going to happen? There's no way of stopping the water because the tap is broken. So the water is flowing excessively. Now, this is what hemorrhagic stroke looks like, or is. This is uncontrollable bleeding, and you need to get them to the hospital. So what are the causes of hemorrhagic? A brain aneurysm, uncontrollable hypertension, age, it depends on your age, old age, and the vessel has no resilience. Now, a TIA, like I said before, is a mini stroke. It's a warning sign that something is about to happen. It must be treated, and you should not leave it because it may cause a long-term complication. When the brain doesn't get enough oxygen from the carotid and the vertebra and the arteries, it can go dead in less than 5 minutes. So you have to act fast. The more the brain is affected, the more it will die, and the less time you have to. You have two sides to your brain, the right side and the left side. When you get a left stroke, the right side is affected. When you get the right side stroke, the left side is affected. So when the right side of the brain is injured, this is what happened. The left side will have hemiplegia, which means it's flaccid. You can't really move. There's impairment with creativity because the left side of the brain is for logics. So it's impairment in creativity, art, and music. You're confused. They are not oriented to date, time, and place. They can't recognize faces or the person's name. They lost depth and perception. Trouble staying on topic when talking. They have left side neglect. They won't see anything on the left side of their body. They're impulsive. They are poor decision makers. They deny their limitations, and they have a very short attention span. When the left brain is injured, the right side would be affected. They have right side hemiplegia. They have aphasia, which is trouble formulating their words. They are aware of their limitation. That's the difference between the left and the right side. Expression, depression, anger, frustration. They have trouble understanding written text. They have issues with writing, which is called agraphia. They have impaired math skills. Their memory is intact. They have issues seeing their right side. So basically, they can only see one side. So the left side can only see the left side, and the right side can only see the right side. So I'm gonna state the risk factor of strokes. Now you have the modifiable risk, which is smoking, oral contraceptive, excessive weight, hypertension, physical activities. Those are modifiable risks, things that we can do to prevent us from getting a stroke. So don't smoke. Contraceptive, don't take them if you don't have to take them. Excessive weight, you can exercise. Physical activity, if you live a sedentary lifestyle, that puts you at risk for getting stroke. Then you have the non-modifiable risk, which is like family history, senior citizen. You're getting older, so your vessels don't work like they used to. Atherosclerosis, things like those you can't modify, so you have to be careful with what you're doing. The signs and symptoms of stroke. Now there's this mnemonic that they have. It's called FAST. So FAST. F is for the face drooping. A is for the arm weakening or arm drifting. So normally, to figure out if a patient is having a stroke or had a stroke, you normally tell them to put both arms out, and if one drifts, then you know they had a stroke or they're having a stroke. They have difficulty speaking, slurred speech, and the time. It means act fast. So F is for face drooping, A for the arm weakening, S is for speech, and T is for time, meaning you need to call 911. Get them on the phone, get them to come to pick the individual up or the patient, take them to the hospital, and act within the given time. So TPA can be given to block clots. However, it has to be given within a specific time. And by specific time, I mean within a 3 hours window. After that, it's going to be of no use really. So TPA can be given, but it has to be given in a 3 hours window. TPA can be given to patients with ischemic stroke. Do not, and I repeat, do not give TPA to a patient that has hemorrhagic stroke. This will allow them to bleed even more, and that's not what we want, right? We're trying to correct the situation, not make it worse. And in doing so, we give this to patients who have ischemic stroke. All right. Stroke patients, they have two types of aphasia. This is receptive and expressive. So for the receptive, they're unable to comprehend speech, which is the Wernicke's area. And for expressive, they comprehend speech, but they can't respond to you. Arabic area. Now they have combination of two, which is called the mixed aphasia. They can do both. There are some words that I'm gonna be saying, and they're directly related to stroke patients. So you have agraphia, that's the loss of ability to write. Alexia, the loss of ability to read. You can't do voluntary movement. They lost the ability to write, lost the ability to read, sensation or recognition known to object, and they have difficulty swallowing, which may lead to aspiration. And you have to be very careful. You have to monitor them, so you can see like how they're swallowing, so they don't have like they don't have aspiration. As the nurse, you want to keep these patients on bed rest. You don't want to have them walking up and down when they're giving treatment, because this can make the situation worse. Monitor their glucose, monitor their vital signs, monitor their INR, monitor the patient, their blood pressure, because this will help you to have a greater understanding if they're getting better or if it's getting worse. And then that will change the direction of your intervention. So this is just a little piece from me, educating you on how to treat a stroke patient, the warning signs, what to look out for. Bye.